everybody. This is another episode of the Mind Body Marathon, and I'm your host, Dr. Leah Cormanick. And to my left here is Dr. Matt Pisanelli, and to my right, Dr. Alia Whitman. And today we're going to talk about regenerative medicine, which is kind of basically a new part of our practice and something that we sort of jumped into with Dr. Leah's help in terms of trying to get both of us better, feeling better, and running, and also to just help the general community, stay away from uh, pretty negative, invasive things like surgery and harsh injections like cortisone shots and things like that. We're basically just trying to move into a realm where we can kind of a little bit more aggressively get the body to heal itself. So, without further ado, Dr. Leah, so go ahead and just kind of fill us in on a little bit of some of your techniques with regenerative medicine side of things.
Yeah, so I named my practice Physician Within because I wanted everything that I offered to allow people to sort of seek out self healing and how the body can heal itself. So, most of the things that I offer within the practice are in alignment with that of triggering your body to bring inflammation in a healthy way to allow your body to heal, and then what else your body needs to support it. Because I fully believe your body's able to heal if it gets what it needs
Yeah.
from a nutrient standpoint, from amino acids or peptides, from PRP or all the different modalities we offer.
Yeah. So, Matt recently just had a pretty bad injury. I feel like that's kind of the theme of every time Matt's on an episode.
We just talk about how I beat myself up.
He has like a new injury. His recent foray is into an injury is hamstring tear and a stress fracture.
Yeah.
Around the knee.
All in the same time. So.
Yeah. So he's a lucky one. And so walk me through, Leah, how you kind of helped him out and kind of what was that game plan there, just to kind of give people a good example of how this works.
Yeah. So again, his hamstring will heal. But in your injuries, those type of things, they will heal. They take time. And sometimes as the body heals, it creates scar tissue, it creates other adhesions or things that lead to misalignment or lead to chronic pain. And so the goal of the treatments that we picked out for Matt, we're looking at one to get you running again in a timely, in accordance with what you're trying to do, and to sort of start working on those chronic things that have been nagging or ailing that sort of maybe set you up for the injury to begin with. And then to also signal to your body of, hey, come work here, come heal here. So we started with just some prolotherapy, I think initially with ozone, to just start bringing in some of those stimulus to your
what
body.
Is prolo? Like, what is that?
Yeah. So prolotherapy traditionally is just glucose. So it's putting glucose into the injured area.
It's a syringe.
It's a syringe. It's an injection of glucose into the area to, again, signal to your body to bring the good inflammation, the healing inflammation, and to produce growth factors and all the things that it needs to produce healing at that one spot. When I do prolotherapy, I also add a few other cocktail. I make what I call an anti-inflammatory solution.
Yeah.
So that includes anesthetic, includes the glucose, includes taurine, which is an amino acid, and magnesium there to help, and B vitamins to help all that tissue regenerate and have the nutrients it needs locally at the source.
Why taurine specifically?
It's just one of those ones that's promotes healing, promotes thing, and what your body needs to repair there. It's what it's needed for those tissues to repair.
It's like a kind of the least common denominator of the amino acids in terms of, I know leucine's a big one with that too, and taurine.
And you'll see taurine on tons of things, like when you buy energy drinks, when you buy those type of things. They're putting taurine on the top there because your body does need it.
Yeah.
And so it's one of those. It's definitely a helpful thing to add into there to help give your body what it needs.
So basically, let's kind of back up a bit. So you have an injury, you have a soft tissue injury, and it's like a tear. And so we need a little bit more aggressive healing in the area.
Mhm.
And so you're kind of calling the authorities on the area, right? You're sort of injecting all these anti-inflammatory agents and the injection itself with the prolotherapy and the glucose and everything sort of corrals the body's immune system to rush it to that area to speed up the healing.
Yes, and you're setting off a cascade of signals to your body to bring in the different parts of your immune system and repair system to bring in those growth factors, those healing things. And then the other piece that I injected with the prolotherapy that I do for both trigger points, for tears, for things is I add ozone.
Okay.
Ozone is not as well known in the medical community. There's controversy around it. There's everything from IV ozone, which I do not offer, to just injectable
Yeah.
ozone. And I add the ozone because it's basically allowing your body to reduce the oxidative stress there that you have
Mhm.
this stress on your body. It's reducing oxidative stress and it's bringing oxygen, helping superoxygenate or
Yeah.
add more oxygen to the tissue again to promote healing because you're giving the body everything it needs
Yeah.
in that spot to heal.
So, how would you contrast some of those measures? And we'll get to more
Yeah.
measures, but how would you contrast some of those measures with something more traditional like a cortisone shot?
So cortisone or NSAIDs or any of those type of traditional things, they're masking your symptoms more than
Mhm.
signaling to your body to repair. So when you're looking at cortisone or NSAIDs, those are anti-inflammatories, which in a way is good in the sense that it decreases the pain, but it's not anti-inflammatory in the sense that when you heal, you're creating inflammation. Your body to promote healing needs to have an amount of natural inflammation
Yeah.
to bring healing. And so it's one of those, it's not addressing the root cause. It's helping with your symptoms and people get a lot of relief, but long term, it's not maybe giving you what you need to really heal and
Yeah.
repair.
How did all this feel?
For me, it didn't really bother me too much. There's a couple. The ozone towards the end was a little bit painful just because I think some of the anesthetic was wearing off, but I was pretty much fine.
Yeah.
You on the other hand.
Yeah.
So the bane of my existence is my Achilles. I don't know why, but I was born with like tiny Achilles. Like they are so frail and beat up. I
It's
always
nothing to
joke
do with the fact that you run miles and miles and miles.
I'm paying for previous sins. So I ran through a lot of injuries in my 20s and my Achilles just became rotted out essentially. And that's literally what they look like on ultrasound. So I too got PRP and prolotherapy and all this stuff. And as you would imagine, there's a little less mass down there, so it's a
A
little bit
little
more
sensitive.
tender. Yeah, a
Yeah.
little sensitive, but it wasn't terrible. I actually felt like the ozone was fine. I didn't really feel much with that. It was the gazillion pricks into my Achilles that was the issue.
Yeah, so, looking at the different areas of injury, right? So, for an Achilles, that's a pretty thick, large tendon for versus like where you had a tear. It's a focal area of injury that we could find on ultrasound and inject there. And a lot of times you can find it even without ultrasound of just where the pain is. The nice part about ultrasound is even really good injectors miss. They've done studies, they've gone across, seasoned orthopedic doctors, seasoned injectors, and they still miss a fair amount of their injections just
Yeah.
based on landmark.
Well, we hear this a lot because I have so many patients that are like, "Oh, I got a cortisone shot last year and it fixed it, and then I felt great for a year, and then it came back, and I went back for another cortisone shot, and it didn't fix it this time."
Yeah.
They, I mean, I probably hear that at least once a day.
Right. And then the question is, did they miss or did it just not it's just not what your body needs,
Yeah.
and or combination, right?
Yeah.
And so that's why I pursued the ultrasound training. And, as far as my background in emergency medicine, we do a ton of things with ultrasound because we know that adds to patient safety and
Yeah.
good outcomes, both for ultrasound guided procedures in the emergency room and for adding them in the outpatient world.
Okay, so let's just kinda head a little bit this direction
Yeah.
real quick. Is cortisone bad?
It's not my favorite.
Like, what does it do to the tissue?
So
Like, say instead of us doing this PRP, ozone agenda-driven technique on my Achilles and his hamstring, he basically needs it all over his body. But instead of doing that, I was like, yeah, I just want to feel better. I'm just going to go to the doctor and just have them inject it with cortisone. Like, what would that do to my tendon or his tear?
And a lot of times it can weaken the area.
Okay.
And that's one of the bigger risks of doing cortisone injections and really any procedure that you're promoting, stopping the inflammation or that you're doing that is that the tissue's not getting it there, what it needs to
Yeah.
heal, and or it's weakening it where you inject it and it can become friable and you have a tear.
Yeah.
Um,
Because the inflammatory process is essentially there to help it heal.
yes.
And if
Yeah.
we anti-inflame it, then we are preventing it's
We're
like you
slowing it down.
yeah,
Yeah.
it's like basically you're trying to redo your bathroom and then you fired the contractor halfway through
Mhm.
and then you just have a kind of a crappy bathroom after
Yeah,
that.
and sometimes it just scars down, and then
Yeah.
that leads to chronic pain, right? And
Yeah.
so the body will, kind of cap it off and, put what it needs down, to maintain function and to keep you moving and doing things. But then once it kind of scars down, then it's harder and harder to regenerate that
Yeah.
area.
I think too with cortisone, like you have to have like a specific injury at that site
Mhm.
and like have a lot of inflammation. I tell patients like cortisone likes to feed off of like the inflammatory fluid that's there. So let's just take his Achilles for an example. Let's just say it was a referral pain pattern from a nerve entrapment higher up into the leg,
Mhm.
and you inject a cortisone into an Achilles that there's not actually an injury. It's going to just eat away good tissue
Yeah.
because they're like gremlins. They just want to eat. And so they prefer inflammatory
Of course you
fluid.
would think of it that way.
But if there's not inflammatory fluid there, it's going to break down healthy tissue.
Yeah.
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 And that's where
I
you see people getting atrophy.
yeah.
Like, or those like people that have had like in their ankle or in certain spots, they'll have like a divot there
Exactly. I
where
see this a
the
lot.
tissue is gone,
Yeah, so a lot of times people, if anybody listening or watching has had a cortisone shot, sometimes the skin will blanch in the area
Mhm.
and then it divots and you're like, okay, well, if that's doing that to your integumentary system, your skin, like what is
Or the
it doing?
subcu-fat
Yeah.
and everything
Yeah, what is
there,
it doing deeper?
Like,
Exactly.
especially
Yeah.
people for like tennis elbow.
Tennis elbow, yeah.
Yeah.
I've
You know,
seen like almost like a half-inch divot.
yeah.
But like for something like a bursitis, that makes more sense in that scenario, right? Like if you
Yeah.
genuinely had like a subacromial bursitis in the shoulder, right here,
Mhm.
and they just kind of go right in, just calm down the bursa sac. That's kind of a good scenario, right, for the cortisone.
Yeah, it's one of those
But other than
I
that,
don't
like that's about it, right?
yeah.
Otherwise, you shouldn't
I just
encourage inflammation.
Yeah, and I'm just not a fan of steroids overall. So
Yeah.
when you see me in the emergency room, there's a few times I give steroids because I talk with patients about, hey, these are the side effects, both systemic steroids,
Well,
injectable
what are
steroids,
the
all
side
those
effects?
things. So for systemic steroids, people get hungry, they get angry, it messes with your hormones.
Okay.
You have all these other side effects. People don't sleep well, it throws off their circadian rhythm, they get sweaty, and it's just some people feel great on them or they feel terrible. It seems to
Yeah.
be like no in between. Where some people are like, man, I feel the best I've ever felt. Like everything doesn't ache.
Yeah.
And then there's others who are like, man, I was hungry and angry and sweating and I couldn't sleep and all those things. So
Okay.
I'm just not a huge fan of steroids. It doesn't mean that they don't work. It doesn't mean that they don't have their place. And for, there's other people out there, they're like, hey, those just aren't for me. My goal is to offer them another option.
Yeah.
And sometimes it's a parallel option, meaning you'll get great results both ways. Sometimes it's really a more superior option because longer term, you're looking at the root cause, you're actually getting healing.
Yeah.
And other times we don't know.
Which will help you age gracefully.
Yeah. Yeah. And so that's the other piece behind this is that I want people to thrive, to be fully functional and long term, doing their best and feeling their best.
Yeah. Okay, so we talked about kind of the first frontier of like injectables there,
Mhm.
but walk us through the PRP. So that's a term that's thrown around a lot.
Yes. Yeah.
It's definitely gaining. It's been around forever. It's been
Yeah.
around for a while, but I would say it's much more in the vernacular, the common vernacular, and a lot of people know about it, but don't really know about it. So walk us through what that means and what the
Yeah.
acronym really means and all that.
So platelet-rich plasma is PRP. When you think about you get a cut on your hand, you bleed. Platelets are what comes to that area and causes it to clot off and starts a whole cascade of healing and bringing in those tissues, bringing in your body's natural response to heal your cut. So we all have experienced that in some level already in our body and seen the power that platelets have in your body to heal. And so what platelet-rich plasma is it's drawing off your blood, spinning it down and separating out the red cells, the white cells, the plasma, and the platelets. So you separate out, you spin down, the red cells all sink to the bottom. You draw off the plasma that has platelets in it. And one of the key things that you need to ask somebody that's doing PRP is if they're doing a second spin, because the second spin is where you really concentrate down those platelets and get it into a smaller volume of plasma. So then you're pulling
Is
that
that
off.
not a common thing?
It should be standard, but there are places that don't do a double spin or that they have like a kit that just you draw off the blood, you put it in the kit and it just spins it and does it and gets you back. Those have less concentration of
Okay.
platelets. So you want platelet rich plasma, meaning you want a high concentration of platelets in this plasma because and then what you're drawing off after the second spin is say you need 3 mLs of, for an Achilles, you need about 3 mLs per Achilles. For Matt, you can use 5, 6 or more mLs because he has a bigger,
For the
surface area
hamstring.
for the hamstring, right? And so how much blood you draw off and how concentrated you get those platelets determine the outcome.
Yeah.
And
Now,
so
is there too much platelets that you can add to an injury where there would be almost too much inflammation?
I have not seen any data on that. I think I think it'd be hard
Okay.
because to get the highest concentration of platelets, you have to pull off 120 cc's of blood, which for both of you, I pulled off 60. And so to get, 18, 20 billion platelets, you need 120. You really want like 10 billion platelets or 5 to 10
That's
billion platelets,
insane.
right? Crazy in your injection. And so to get that amount, you really need more than 30 to 60 cc's of blood to really get that concentration. Then when you spin it down, you pull it off and you do a second spin. And so you're left with, say, of those 30, you're left with, say, half is 15 cc's of plasma with platelets. You spin it down, you pull off another 10. So then you have the platelet poor plasma you pull off, and then you mix in those platelets that you've separated out on the second spin into what's left of that 5 mLs.
So you can't drain all of my blood from my body.
No.
Go vampire status.
So, and what then those platelets do is, so those platelets, when you inject them back in, they then set off that same healing cascade like when you cut your hand. And so you're getting the growth factors, you're getting cytokines, all those, that cascade that you need, you're basically signaling to your body without slicing your hand back
Yeah.
open. And so you're harnessing the power of what platelets can do by directly putting them into that injury or that tissue that needs to regenerate. And again, similar to cortisone, when you trigger that healing cascade, that tissue is weakened. And so
Yeah.
I think the biggest struggle we had for both of you is that you're extremely busy, you're very active, and picking a time frame where you can have downtime is hard. And that's one of the keys for picking when you do the procedure is one, preconditioning and making sure that you've followed some basic instructions, which we can talk about leading up to your procedure. And then after having a good week, which I had to like harness the both of you, like, give me 4 days, please, 4 days, but ideally
Yeah.
2 weeks, of really resting the area. If you can do a week and then start adding back 10% per day, 10% per week, to allow that tissue because it's going to feel better
Yeah.
and it's going to be weakened. And so putting you in a place where you feel good, but it's weakened puts you at promote additional injury.
Yeah. Yeah. So, okay. So then we have the PRP side of it. We also did a stem cell.
Yeah. So
We in it to make it a little bit more effective. So walk the crowd through that, what that means, and kind of what the goal there was. You got it too, right? You didn't get the
I
stem
did
cell.
not.
Yeah.
you did not. So stem cells are exceedingly expensive because of the regulatory component that goes into getting them and getting them with integrity and knowing that where they're sourced and that they really are what you're buying. So that's the hard part about stem cells. So the expense of that goes up quite a bit. And so I don't typically advise patients jump right to them unless they're trying to get to a race in the fall right away.
Yeah.
I wouldn't know anybody in this room that's doing that. So that is typically what I tell people is try a series of injections. Start with prolotherapy, see how you do, see how much improvement you get. I am aiming for 20 to 40% improvement with one set of injections. And then if we get to 100, great. There's some people that get one injection, they're like, I feel great. And that's all they need. Or
Yeah.
maybe like for a knee, they need it 6 months later or a year later to kind of get back to that healing because you're still aging, right? You're still
Yeah.
aging through this process. Um, and then, you get through PRP if you do a series or injections. Stem cells is really the next thing.
Well, what's interesting about your tactic here is that when you when you go to like a traditional orthopedic and then say you have a knee issue and you're going to get PRP, they wouldn't lead typically with prolo and fascial release and all that sort of stuff. They're going to lead pretty much right to the PRP
Mhm.
because it costs more and it's a good reimbursement and it just kind of makes sense financially for that provider. But what I like about your strategy here is that you're sort of just starting with, the least invasive thing
Mhm.
and the cheaper thing,
Yeah.
and then working your way up if you need to, all the way up to the more expensive levels.
Yeah.
And it's just ethically right. I think it's the right thing to do.
Yeah, and that's where the heart behind like Physician Within is I really want you to heal and not need me. My best marketing strategy is to have people heal, not need me, and tell their friends. And so I think what's hard too is part of getting great results is good patient selection. So I've had a couple patients come in that I'm like, you don't need a knee injection. Your pain is from myofascial pain in your knee is from your all of your thigh and up into your glute.
Yeah.
We really need to work on the fascia. If you're going to spend any money working on fascia release and that type of stuff, it's cheaper, less invasive, no risks. Like fascial
Yeah.
work, the only risk is bleeding or bruising. The risk is so much lower and it's actually going to fix your problem. And I think that's the harder part of my job is to unsell people on things
Yeah.
they decided that they already needed, and you're
Well,
like,
that's
"Actually,
our
that's not
world.
your issue."
I mean, our world is managing, obviously we're chiropractors, we manage the alignment of the individual, but um, just as much of a focus is on managing the soft tissue. And we look at it through the lens of fascial lines and
Mhm,
trains of fascia. And that's our world is managing fascia. And so if we're not getting somebody better quicker, they're always looking for the next step up. Um, and sometimes what might be the case is they aren't getting frequent enough treatment of fascia,
mhm,
which is why I think, and this is probably the vast majority of clients.
mhm.
I mean, I would say 75% of clients probably could benefit from not anything invasive, but just more consistent work on their
Yeah.
body. And that's why I like the idea of like teaching them. I
Mhm,
like my patients to buy cups. I like them to buy tools. I want them to become better at that. I want them to become skin in the game, if you will, where
yeah,
they feel connected to their injury and they're actually trying to help manage it on a day-to-day basis. I think there's a better buy-in and there's better outcomes that way.
100%.
And
And
that's
that's how
also
I
what
got
I
better, was
yeah.
you told me you were like, "Hey, that's your whole anterior fascial line." I'm like, I don't know what that is. How do I not know this? How did I go to med school and don't know about fascial lines? I
Yeah.
know what fascia is. And that was really what, a year and a half, 2 years ago threw me into this deep dive learning all about fascia for my own healing
Yeah.
and figuring that out. And then as far as my practice, what's hard is I'm not a massage therapist. I'm not a body worker. So I'm not used to structuring an appointment to get through a whole body treatment
Yeah.
in an hour or even an area. And so like you, I decided to incorporate I went and did, Ashley Black's Fascia Academy
Mhm.
and life
The
changing.
fascia blaster.
Yeah, the Fascia Blaster. Um, and what was really cool is while I'm there with NFL trainers, I'm there with massage therapists, cosmetologists, like all different walks of life. And I wasn't the first physician to go through it, but it's one of those I decided the best outcomes for patients is if you work on your fascia or whatever the area or zone 20 minutes, 5 days a week. So if you get
Yeah,
an
what does she
outcome
say? She says,
for 90 days.
yeah, 90 days. So
Yeah.
20 minutes for 5 times a week, 5 days a week,
Yeah.
not just
5 out of 7. Yeah.
you don't wanna do 5 treatments in one day,
Yeah.
but 5 times a week, and then, for
And they
90 days,
showed
that's what they're looking for, yeah,
and they've
which is quite a buy-in.
done peer review studies. So it's not just like somebody blowing smoke and marketing a device and whatever else. Um, Peer reviewed studies that show they did on ultrasound. They documented an ultrasound before 30, 60, and 90 days and showed the reorganization of
Yeah,
tissue from from muscle and all the different areas that they had the test subjects do their legs.
Yeah.
And so
Which is
they
easier.
yeah, because then they can ultrasound there and show the reorganization of the tissue. And so, like you said, we looked at your Achilles before we started doing injections
Yeah.
and before we started doing the fascial work on it, and it was totally disorganized. And
Yeah. It looks like my little daughter's hair when I have to manage her hair. Like she always has knots in her hair.
yes, and
That's what my Achilles look like.
it's the basic. That's the best way to describe it is a knot in hair, and you're just trying to brush and get it all to straighten
Yeah.
out and organize to flow and to have fluid
Yeah.
movement.
Structurally, I also think of like if you crumple up a piece of paper, crumple it up, and then you stretch it back out, you still want to get through and then like working the actual fascia is like working out those fine little crinkles and
Mhm.
just taking like the edge of a pencil and go and just smoothing it out.
Yeah. And
Matt,
adding some heat.
do you do the 20 minutes for 5 times a week?
I haven't yet, just because
His tools
one,
are en route.
yeah, my tools aren't here yet, but I definitely have increased. I didn't at first, just because I wanted the tissue to rest.
Yeah.
Yeah.
I did follow orders, and I actually waited 2 weeks before I really got after it.
Proud
Just
of you.
I didn't. I ran every day.
Yeah.
He's like, hey, I just ran 6 days. I'm
such
like,
a hypocrite.
Leo.
No, because this isn't my first hamstring tear. So,
Yeah.
and that's kind of why I went this route.
Mhm.
Just because my first time tearing it, it took almost, 11 months to heal, like naturally, just by leaving it alone. And
Yeah.
I don't have 11 months this time
No.
to wait around. So,
Well,
Yeah.
what happened with me, so I got the injections, I went on vacation, and then I started running. Well, it was the following week. So I started running like 10 days later. So I wasn't terrible. But um when I was using the tools, like basically a lot of times for me, I'll go on a run and my Achilles just it feels like leather, right? And then but after I got the injections, it did feel better as you were saying. But then what happened was I literally felt like I just needed to just rub them out after.
Mhm.
And then so I did that. So I went for the run and then they were nice and warm. So that's the other thing about this fascial kind of treatment, self fascial treatment. Whether you have cups or scrapers or whatever, you want to make sure the tissue's warm. So
Yeah.
take a hot bath, take a hot shower, get in the sauna, or do it after a run or a workout where the tissue is intrinsically warmed up from the effort, or extrinsically like from the sauna or the hot bath. And you just once it's warm, you can get a better release and you just start working it. And you literally just go after the tool. Like if we had this crinkled up paper and you had like the tool, you would sense that basically anybody watching, you would sense where the wrinkles are. You'll kind of know where the
Feel it. You
tissue
can hear it.
doesn't want to move. And I know you're not a trained physician, not a lot of people watching this, but it's just an intuitive thing. You get the sense internally of where the issue is. Like if you're on a run or a workout, you know where the binding is. You know what your brain is hyper concerned with. And then you kind of just go after that area and it'll feel like leather. It'll just feel rougher. It won't be smooth. And you kind of just hunker down and just really just try to break that area up. It's just that simple.
Yeah. The nice thing about self-release too is that you're getting the tissue, initially, like, so say you haven't run or something, you're working on it at night, you get the tissue warm with the different tools. So you get the tissue warm and then you go to a pain level, not more than 4, and you just
Yeah.
slowly start breaking it down time after time, by the 5th, 10th, 30 days, 90, 60 days, you're getting deeper in that tissue. And it's kind of like the knot of you got to start at the surface level or
Yeah.
at the tips and kind of get it out and kind of keep working. And if you're just slowly working, getting that tissue organized and in alignment to where it can really glide and move.
Yeah, and that's the important thing is that anybody that has like an ache and pain and they're looking to do a little bit more self-management at home, if you're trying to release a tissue, do not go in heavy-handed. Like do not do that.
Start light. Yep.
Because if you do that, like if somebody like came up to you and just like grabbed you and just like, really wrenched on a muscle that's tight, you're going to like flinch and you're going to like fight back. That's a natural reaction to the muscle. So the same thing will happen to your tissue if you like go in heavy-handed and just really start hammering it right off the bat. That's a terrible thing to do. You literally almost want to just like kind of gently like stroke the area and, as you say, desensitize it.
Yeah.
And I
We
really
kinda had
like
to
one of
just
her tools that does that because it feels so good on my Achilles to desensitize it after a run. And then I can, once the nerve endings are not as frenzied and not as alarmed, if you will, then you just go in there and you can get a little bit as time goes on, as the 20 minutes goes on. The last 10 minutes, you can get so much deeper but you just have to ease into it.
Yeah, it's definitely a patient practice, which is again new to me from coming from the ER world to fascia work. Is being patient and again being patient with your body, even right. Healing takes time. I think that's the hard part about some of the services I offer is that this isn't the quick fix.
Yeah.
Microneedling or some of the other things that we do here with PRP, it's not the same as if you go to the med spa and you get Botox and fillers. You're gonna walk out of there looking immediately better versus PRP, microneedling, those type of things, they take time. They take time for your body to build up those cells and to regenerate.
So, what is microneedling?
Microneedling is taking a set of small needles, microneedles, and there's different size pins. So you can have from 36 to 60 needles in a almost like a square centimeter. So
Mhm.
you're using that to kind of stamp the skin, and the needles are going down in through the skin. And the device we have does radio frequency as well. So while it's in, it releases heat or radio frequency underneath the dermal layer,
Okay.
right at that dermal junction to promote collagen. And so what you're doing with the microneedling is you're causing, again, a small amount of tissue injury with then recruiting your body's natural response to make collagen and increase skin elasticity in
So
that area.
it's like a very kinda specific version of, like, acupuncture, dry needling,
Yes.
but with less injury per se because the gauge is so much smaller.
Yes, it's a 30 kg needle. So it's a
Y
tiny, tiny
tiny.
little needle.
So what is this used for?
This is used for skin elasticity, tightening, fine lines, wrinkles. It's not a miracle worker. There's
So
people
it'll be
that
good for my acting career?
yeah, it
I'm
would.
just kidding.
Yeah. So Samoa might sign you up. You
Yeah.
never know.
It's good for her acting career.
So it's one of those things that if you've lost a ton of weight and you have excess skin, that's not a great procedure. It can help tighten, and fascial work can definitely help with excess skin. And it can slowly help tighten, but it's not a miracle procedure. It's not the like walk in, walk out, great before and after pictures. It's just a way to age gracefully and sort of help your body regenerate that tissue again in alignment with your body healing itself, your body using what it has to heal.
Yeah.
Yeah, you're not putting chemicals into yourself.
Yeah.
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 Um, so you look a little bit like a puffer fish after you use it for, like, the rest of the day?
Yeah, you get kinda a little bit swollen. You can go back to work. I mean, within an hour, the swelling's back down. You're
Okay.
still a little bit numb. So a little for a extended period of time, but the swelling goes down the next day. Sometimes you can have some swelling and kinda, like, look how it's like there's days where you just wake up and your face
Yeah.
is kinda puffy, but mostly not, like, noticeable. You can go right back to work. You can wear mineral makeup. It's pretty minimal downtime, and then same for, like, the body treatments. It's minimal downtime.
So let's circle back to, stem cells.
Yeah.
So let's kinda rehash that and make sure we no stone
Yeah.
unturned there. So what exactly it's not actually stem cells,
No, so it's
right? First off.
not it's what I offer here is not I'm not giving you someone else's stem cells. It's called bioallograft is what it is, and that's fancy words for saying that it is from placental tissue or cord blood matrix, not blood, but cord matrix, placental tissue, or amnion, the amniotic fluid. And so they are harvesting those cells that, again, similar to platelets, have the ability to set off this cascade to recruit your body's stem cells to make a robust response, healing response.
Mhm.
And you can do that both by giving them systemically, by giving them IV, or locally injecting them. And so,
So if we go back to high school biology, these are like the really early cells that can be then transferred into a multitude of different cells,
yes,
right?
and are stimulating your body to differentiate
Okay.
your stem cells into the cells you need.
So you put it into an injured area and basically your body just then determines what cells it needs based on that raw material.
Yeah, it's basically again, it's putting what your body needs, and it's the flag or the signal saying, "Hey, come here, do this. We have
Okay.
everything we need to start this signaling, this repair." And it's a more robust response because it's stimulating your stem cells, not necessarily along with the cytokines, along with the growth factors, but it's also stimulating your bone marrow to make stem cells to come there to
That's
heal.
cool.
So there is other procedures where you can do like bone marrow grafting and those type of things. I don't do those here.
Yeah.
And that would be getting your stem cells and
Okay.
re-injecting them.
That would
But
be
that's
so painful.
it's just one of those things that there's a ton of things you can offer.
Well, that's kind of why I wanted to have this episode, is that they're like, just to get people thinking differently
Mhm,
about, oh, my knee hurts, I'm going to get a cortisone shot. And if
mhm,
that doesn't work, maybe I'll seek something else out. Like, there's so many other
mhm.
ways. Like if you watch any sport, you watch the NFL, you watch the Olympics, like they're not getting those things.
Right.
Maybe in the NFL they are, because that's whatever. They're just trying to get to the game. But like in a sport like in Olympics, where, for instance, with track and field, I know this is almost never the case. You genuinely want the body to lay down healthy tissue, so you're not just trying to get through the game. You're trying to like extend your season and
Your
create.
career.
Yeah, exactly. So you're not going to do these measures. So the general public is not privy to this information a lot, because they're just sort of given the idea of like, oh, well, there's just a cortisone shot in PT and that's all there is.
Right, and for some people, that's what they want. I think that's the hard part, like, I'm not disparaging any of my colleagues or things because there's a lot of times where people come, like, in the emergency room and they're like, "This is what I want. It
Yeah.
helps. I research it. This is what I want." And it is a quick fix,
Mhm.
and a lot of society is looking for a quick fix. So it's really these regenerative treatments are for people that are looking to get to the root cause, that are looking to take a little slower approach for the long game,
Mhm.
for, to be, to get the best healing and the best tissue response for long term.
Yeah.
And so again, I think it just depends on what patients are after. And, that's why I do a regenerative medicine consult, because I want to examine you and say, is this a good procedure for you? Because I am taking people's money to do these things and I want to make sure they get a great result.
Yeah.
And I don't want to take someone's money if they're not going to great result, because and that's what's been hard even in terms of like picking what procedures to offer in my practice.
Yeah.
There's so many things you
There's so
can
many things.
offer, but they don't always get you the long-term
Yeah.
result. And even though you can make more money doing something else, um, I'm trying to stick with things that I know are going to allow the body to heal.
Yeah.
Yeah.
So you had us, you gave us a little vial and we have to inject it for 20 days. What exactly was that after the period?
Yeah.
What am I
So
injecting myself with?
yeah, so that's peptides treatment. So that's some of the cooler things that are coming out in medicine. You're like, what am I doing? Which I
It's
did
like,
talk
whoops.
with. In fairness, I did talk to him at length about
No,
this. So
but I'm about as ADD as they come. So half the time I'm like, if I'm not 100% thinking about it, then it's just like I'll get about 25% of what you're saying, and I'm like, okay, I'll do it. That's fine.
yeah, yeah. So peptides. Peptides are amino acids. They are things that your body naturally produces. And they've found, there's different peptides that are missing in different processes or that help stimulate your body to repair, heal in a specific way. So certain peptides help in different ways. Like glycine helps in the gut. So if you're trying to heal your gut, glycine is really useful for that.
Which we talked about with the glyphosate in a previous episode.
Okay.
Mhm.
So, and then looking at, so for tissue repair, BPC 157 is hands down the body protective compound, is what it's called. It has done wonders. People really heal from that. It was taken off the market. The FDA said you can no longer use it for IV treatments. And then they gave a general guideline of like, you shouldn't really be doing it for injectables any longer. But it used to be paired with thymosin beta 4. Thymosin beta 4, again, another peptide or amino acid that helps heal. And so you guys are both doing thymosin beta 4. And then
Ching.
um, we were still able to get some BPC 157 for Leo, but aren't unable to get that any further. So you can still take BPC 157 orally. It's one of the few peptides that survives the gastric acid, and you can still process and absorb it. And I think that's one of the hard things about nutraceuticals is what gets through the stomach acid and you
Yeah.
actually absorb and what is just taking things that are getting broken down.
Yeah. So I'm like, I've become superhuman over the last 2 weeks. I've been able to do pull-ups now.
Well, one of the
No, I'm
reasons
just
why
kidding.
it survives the stomach is wasn't that initially where it was found? It was secreted in the stomach to help heal the stomach from the acid that it comes after every meal. So that's why most people don't get ulcers in their stomach, is because the turnover of cells in the stomach are so high,
Yep.
and that's what they initially found.
Hmm.
found,
Right,
you
for the
know, the
healing.
variation of it. So
Yeah, that's
Yeah.
cool. I didn't know that.
Yeah. So here at my practice, there's a homeopathic supplement that I offer for IV that has peptides in it. That's a homeopathic, and then version of those, and that
So
sort of my jump
explain that
start.
a little bit. What is homeopathic and the peptide infusion and all that?
So peptides and all of those medications are depends on where you source them, how you get them, and who is making them. So homeopathic is way saying like, hey, you understand that these medications really help you and benefit you, but they're coming from the homeopathic world in terms of it's looking at how to get these compounds from um, sources like that you're getting them from herbs or from other
Yeah.
sources. And then versus like a compounding pharmacy where it's isolating this specific, exact compound.
Mhm.
And so that's a way to get a broader spectrum of peptides in a smaller, thing because you're getting it across from nutrients, right? And then looking at peptides that I can get from a compounding pharmacy, that's where like we got the little vials of exactly BPC
Yeah.
517 thymosin beta 4. And so for patients that are looking for peptide therapy or they say like, hey, I've been reading about synapsin, those are all things that in a regenerative medicine consult we can look at, what peptides are available, what would be a good fit for
Yeah.
you, why it wouldn't be a good fit. Like peptides that are really common right now are tirzepatide, or semaglutide, the weight loss ones. But for tirzepatide, it's contraindicated in people that have a history of thyroid cancer or family history of thyroid cancer. So
Yeah.
just because these compounds are what your body has, there's still pros and cons
Yeah.
and contraindications to taking some of these. And so that's the important part is if you're seeking out peptides to make sure you're getting it from somewhere that's going to have those
Mhm.
conversations. Because I am offering the weight loss medications, but I'm sitting down and having a really in-depth conversation about what we're
Yeah.
doing, lowest possible dose, all those things that you really got to make sure it's you're safe candidate for any of these things.
So let's thanks for being thorough on that. But
Yeah.
let's shift directions a little bit and let's chat about sex hormones, which is definitely another common conversation.
Mhm.
So obviously testosterone for males
Mhm.
and women hitting menopause and kind of the shifts there. So what's some of your take on like what's kind of like your game plan for that?
So I haven't drank the Kool-Aid on hormone replacement therapy.
Yeah.
That's the base, the generic, like the short answer is, I think sex hormones are abundantly important. I think they play a huge role in terms of how you feel, how you perform. But I know we've talked about it. There's sort of a hierarchy in terms of how you adjust or what you
Yeah.
go after in terms of functional health. And so sex hormones are actually the last thing to adjust.
Yeah. So what she's alluding to is that um, there are, if you want to think of like cogs on a Swiss watch, like if you turn one dial, that turns another dial, which turns another dial, and eventually the watch goes around. That's in a crude way, sort of how the cascade of uh, metabolites and hormones and whatnot in the body sort of work. And we'll kind of just loosely say that gut health sort of drives the adrenals,
Mhm,
which is cortisol and things like that. Some other compounds there too, but the adrenals then drive the thyroid,
mhm.
and then the thyroid then drives sex hormone. So if we go to a doctor and we're like, I got low testosterone, whatever, let's get an injection. And it's like, well, if you bypass the thyroid and bypass the adrenals and don't clean up your gut, well,
You're
that's a
just gonna
little
have a ton of side effects.
yeah,
Those are the
that's pretty
patients that have
dangerous.
yeah, it's dangerous. You're not gonna get good outcomes. You're not gonna get the outcomes you're looking for. You may feel better for a short time, but those are the patients that have really crazy, like, for testosterone, crazy acne or just rage or all those other pieces of
Mhm.
it because you haven't a lot of times addressed the adrenal or the other parts of the hormones. I think the other piece that I personally really underestimated before going out into this field is the power of vitamin D
Mm.
and how vitamin D is a hormone. Actually, it's a fat soluble hormone. And it is the base of all of your sex hormones and other hormone synthesis. And so if you don't have adequate vitamin D and you just start giving testosterone, again, you could have fixed potentially by just taking vitamin
Yeah.
D.
Yeah.
So there's so many easy interventions. They take time
Yeah.
right? It's not the same as getting a shot and just magically, like, suddenly you're back to normal. They take time, but it's how your body's built.
Yeah,
It's
it's
how your
creating a
body
better
heals.
infrastructure
Yeah,
for healing in the long term.
yeah. So it's
So
the root cause. Again, it's the whole heart behind my practice is to really find what's driving this. So
yeah.
how do we fix the break, the metabolic break?
One of the things that you mentioned to me that was really interesting was that, I was telling you, I feel like every day I give Aaliyah a new new symptom of mine.
Yeah.
It's like when you really put it all out there, you're like, man, I kind of go through a lot. But I was just telling her the other day and about we were talking about vitamin D, and I take a decent amount a day. I think between 12 and 14,000 IU a day. And historically, I've had a lot like bronchitis, a lot of lung issues. I've had 12 fractures in my life, so I definitely have had a lot of vitamin D chronically in my life. But I think that's better now. But you made a really interesting point about even if I take it orally, what might be some components there to consider with
Yeah.
vitamin D.
So the other component is looking at your genetic makeup and if you have, those SNPs that allow you to metabolize vitamin D. And there's some
SNPs are single nucleotide polymorphisms, basically part of your DNA that are slightly altered that make it function a little different.
yeah. So genetically or from your parents or whoever, do you not metabolize vitamin D or make it as much as you should in the gut, right? And so for those patients that have alteration in that, you may need injection because you may not synthesize it through the gut or absorb it and maintain it in the system the same way as someone else. And that's where when again, you can do genetic swabs and we've talked about this too of I offer precision medicine. I offer looking at the genetic, genomic swabs. But for most patients, unless you want all the exact data, you can start by supplementing with vitamin D. If we supplement and you're on a high dose and you're not getting your vitamin D level 3, 6 months later is still low, then it's worth going after that.
Mhm.
But why start with the
Yeah,
$600 swab when you could just start taking vitamin D and
true.
see if you get your level up?
But um,
But for
and
someone like you,
that's 100% true. And I guess I'm mentioning that because I do know there are some cases out there
mhm,
where people take a ton of vitamin
they
D
do.
and they don't respond.
Correct.
And I have a couple patients where I'm like very confused by their injury patterns in the sense that they're just not getting
Mhm,
better. And um, I trust my work enough
mhm,
that if somebody is not responding in a normal fashion, that we're up against something,
mhm.
you know, much larger. We're up against infrastructure that is different,
Yeah,
you
and you're
know.
not gonna heal without magnesium and vitamin D. That's the other thing, and that was one of the first things I said to you both. If you need to be on 10 to 20,000 of vitamin D with K2, and you need to be on magnesium every day.
So what did she tell you for magnesium? How much did she tell you? It was a
It
lot.
was a lot
It's a lot, and it's one of those
What
you
because it was
underestimate
like 6 to 800.
400 twice a
Yeah.
day.
400 twice a day. That's right.
Yeah, so you underestimate
400 milligrams.
Yep.
Yeah. And what's the best source, you think?
So that's like
Glycinate,
yeah.
stearate, like all that.
I actually did an Instagram post on it. If you wanna go follow me on Instagram, you can see my post about
Yes,
magnesium.
absolutely.
Um, but there's about 8 or 9 different types of magnesium, and they each have different qualities of, 1, how they're bioavailable through the gut, 2, what side effects they cause. Like magnesium citrate, we give that to patients in the emergency room that are constipated, and we actually tell them, "Here, take this with you because if we give it to you now, you're gonna have an accident on the way home, and you're gonna hate us. So take it when you get home," because it's not bioavailable, it's not absorbed, it pushes through the gut really quickly. And so when you're thinking about different types of magnesium, malleate, threonate, glycinate are really good for muscle, bone, those
Mhm.
type of things, and they're tend to be better absorbed, but some of them may not agree with you personally. And
Yeah.
so the best magnesium for you is the one that you can tolerate in terms of GI side effects, constipation or diarrhea, and that you're going to get enough of at that dose. And so I typically like glycinate, malleate, threonate are the kind of ones
Yeah.
that I like.
Would you prefer somebody do one of those or do multiple?
Yeah, that's a good question.
Um, I don't know that I've seen any different outcomes in the patients I've treated or that me personally
Mhm.
trying the different, ones that I've noticed. I do notice when I switched years ago from mag oxide that I was buying at Costco in bulk. You can buy when I switched from that to the blend that I bought was 3 and 8 and glycinate, I think, or malleate and glycinate. I can't remember what the blend was. I did notice a big difference in terms of like muscle recovery,
Okay.
soreness, those type of things.
So how would somebody know if they're not absorbing it well?
I think side effects, and also one of the things I look for is when I check your blood work, say you've been seeing me for 3 months, we recheck your blood work. I look at RBC magnesium,
Okay.
which is looking at, you can look at magnesium in the serum, which is how much your body is pulling from the bones and things to keep the serum equilibrated versus how much magnesium is actually getting into the cell. So when we're looking at RBC magnesium, we're looking at how much magnesium is actually into the cell and absorbed. And so there are some people that need really higher doses, and that's or a different form. And you can say like what you're doing is not working. Kind of the same thing as vitamin D of, I know you said you're taking a ton, it's just not enough for you.
Yeah.
So, and that's where then it becomes the art of just seeing what works for patients and or how they're feeling. If they're taking the magnesium and they're like, man, I feel a lot better, then you're clearly absorbing it.
Hmm.
If it's not working, then I think that's when you start looking at what is your blood levels? What are you actually absorbing?
Any questions, Matt?
What are your thoughts on sublingual versus just oral?
I think that people tend to certain medications absorb better sublingual, and like there's all kinds of like troches you can get or liposomal solutions. I don't know the data on that.
Okay.
I would think because you're bypassing the gut that if you're getting the absorption there, especially that it would potentially be better because you kind of know you're dosing and absorbing it there, but I don't actually know the data on that. And I don't know that I've seen sublingual.
Yeah.
I was just thinking of the patients who already have like gut absorption issues
Mhm.
until it's calmed down. Like,
Yeah.
they're just not
Yeah.
absorbing those nutrients.
And that's kind of where I start with patients in my weight loss clinic, in muscle injury clinic, those type of things of you have to start with the gut. And I think people get a little bit frustrated because they're like, I have to wait a month to start my medications. It's like, yes, because if your gut's not healed and if you're, starting these
Yeah.
medications or starting things, you're just gonna have a ton of side effects. And it's not gonna work as good versus if we're fixing the root cause. Again, we're
Yeah.
fixing the root cause, you're gonna get better at lower doses and faster.
Well, even considering circling back to the very beginning of our conversation about the PRP and prolotherapy and everything and trying to instigate inflammation, if we just make a hasty generalization and say, 70% of your immune system is in your gut, and it's like, if you're not managing your gut well, you're not getting a good immune response.
Yeah.
So you can pound the injectables, but
Yeah.
it's like, if you're still not managing one of the most key aspects of your existence, which is your gut, then you're going to get a muted response.
Yeah, and one of the things that I talked with you guys about too is like preconditioning, right? Making sure that we spend a week or 2 before your injections and before you started on any of this to like we talked about how your gut health was doing, if you felt like, you had taken care of that. We talked about no alcohol, talked about, decreasing if you were taking NSAIDs, which you guys don't because we all of us don't like taking those.
Mhm.
But we talked about preconditioning and getting your body in the best place possible to have the best response
Yeah.
to these injections. And then again, after your injections or after you start these medicines, what does that recovery
Yeah.
period look like again for giving your body the optimal way to heal?
So I'm
So-
glad you brought that up because when we were at the trials, I was asking every athlete that I worked on, like, well, what have you been doing? And I was blown away. Probably 90% of them shockwave. And so a lot of people that aren't at high end just don't even know about shockwave. And two, almost everybody has tried PRP. So I
Mhm.
asked them about like, well, what was because at this point
That was
I hadn't had it.
yeah.
Yeah, I was getting ready to do it. So I was asking them on their intake, and they just had the injection with like nothing beforehand. And it was just like, I've tried everything else.
That's what I'm saying.
And so
Like,
they didn't condition their bodies properly beforehand. Afterwards, they were just like, yeah, I just went out and started training again. So
Yeah.
I mean, I'm sure that most of them were told like to rest for the month or whatever it is.
I don't know. One of the high level athletes that I spoke to here in the clinic, he was like, "Oh, I mean, I've never had to rest. I've had this done before." And I'm like,
Mhm.
"Well, I'm telling you, I'm giving you the information I have. You need to make a good decision for you and your body. But I think it's not good to not to give you that you need to have this information.
Yeah.
If you choose not to rest, that's on you.
Mhm.
But to give you a potential to have a higher chance of injury and not tell you to rest is it feels really
Well,
negative
it's
to
like
me.
somebody wanting to go fast, so you're like, "All right, here's the keys to a jet. Let's go." And then you
Yeah.
don't have no training on it
Yeah,
whatsoever,
you can
and
go
then
fast, but there's gonna be trauma
yeah.
involved.
Yeah.
Yes.
So, okay, let's quickly circle back to
Mhm.
the getting people prepared for a better response. So you mentioned no alcohol. What else are you going to say to them?
Cut down sugar to no sugar if you
Yeah,
can.
good.
Like sugar across the board is the most inflammatory. And even before I started into this field and I was seeing you after my surgery and healing and stuff, I was like, I know I gotta cut out sugar. Like, I know that's the first
Hmm.
step, and so sugar, alcohol, if you can do gluten-free or gluten light and dairy-free. I'm not saying you have to be gluten-free forever. I'm not saying you have to be dairy-free forever. You may find after not be having gluten or dairy for a week or 2 that when you take it back, you're like, "Ooh, I feel terrible."
Yeah,
And also the quality of gluten, dairy, that's a whole other side conversation, but, so I tell patients, if you can give me, a week to 2 weeks pre and
yeah,
at least 2 weeks post of no sugar, no alcohol, gluten, and dairy, you're gonna get the best response
good.
because you're not gonna get the bad chronic inflammation response, you're gonna get the healthy healing and allow your body to really put all its efforts into healing
Yeah.
versus managing all this junk you're putting in it.
Did you follow those rules?
Yes, absolutely.
Good.
Yeah.
Leo did too,
um,
100%. As he went on
The
vacation.
yeah.
alcohol, yes. I did not drink, anything.
So you were bad on the
And these
sugar.
are the best results, right? Like, these are how to
Yeah,
precondition and get the I also expect and want my patients to be human, and you're going on vacation. I want you to enjoy that with your family.
yeah,
It's not about handcuffs. It's just about understanding the decisions you're making and understanding feasting and fasting.
yeah,
There are times where you need to cut back, and there's times where you need to let loose and enjoy. Joy goes a long way for healing. And I think that's the other piece that we've
yeah,
incorporated into the practice is mind body therapy. We haven't talked a ton about that, but that's another huge piece.
yeah,
The studies out there across the board show that mind body therapy works. The hard part is finding something that in today's culture you can do.
yeah.
Like yoga, I end up sitting there thinking about my grocery list and which one of my 4 kids is doing great or struggling, all the different things at the practice,
Hmm.
etcetera. And I don't know what you guys have had experience with mind body therapy in the past.
Yeah, I mean, that's definitely, for me personally, managing that with running is the best.
Mhm.
A lot of times people go, "What do you think about when you run?" I go, "Nothing. I just run." And it's awesome
Yeah.
Mhm.
because, it clears your mind and I might have a random memory pop in, but I don't have an agenda and I just try to clear my mind because, then it could be a sharpened tool when I need it to be.
Mhm.
I think coming out of an injury is, like, the best part of running because, like, you just don't even look at your watch. You're
Yeah,
not
you're just
concerned with
chilling.
it. You're just going based off of how you feel,
Mhm.
you know, and then just taking in the surroundings.
Yeah.
Whereas once you're healed and everything, then you're now focused on your workout and everything, and it becomes a little bit more. It's still fun, hopefully, for most of you who are in that workout phase, but it becomes a little bit daunting.
Yeah. Yeah, so I mean, I think we're kind of rounding third here and wrapping
Mhm.
up the episode. We're coming up on an hour, which has flown by.
Yeah, I
This
was gonna
is
say it feels like 10 minutes.
seriously. That's what happens when three nerds get together and
Yeah.
geek out on
Yeah.
stuff.
Yeah.
So before we end, just because we've touched so much on what we've done pre, what are
Mhm.
some of the big, like key, like 3 or 4 things that you would tell patients not to do afterwards once you've had the procedure, so that
So
way they don't ruin what they just did?
ideally 2 weeks of rest
Mhm.
before you go back. If you can give me a week of rest or 4 days like someone else, then I will take it. But really a good time to let your body heal is probably the biggest thing. Then the second thing behind that is the things you can do to calm inflammation in your body and make sure that you're getting adequate rest, vitamin D, the mag, those type of things that your body needs to heal. And I have a whole treatment page on what to do and what not to do. The other thing is
Yeah,
ice and NSAIDs.
yeah,
Do not do ice or NSAIDs. Heat, if you heat, and if you have to take something, Tylenol, arnica is good, salve, CBD oil, lidocaine patches, those are all great. But ice and NSAIDs decrease your inflammatory response. So it's basically you're paying a ton for a procedure and then you're blunting how it works.
yeah. Yeah, and then the other thing I remember you told me that I take 4 grams of fish oil a day,
Yeah.
and you were like, "Yeah, don't do that."
Yeah. Fish oil, curcumin, those vitamin E, those type of things that are all anti-inflammatory, if you can stop them at least 7 days, if not 2 weeks before an
Yeah,
injection and then 2 weeks after, the longer you can get out from your injection or your procedure, the better, again, that you're not nixing or kind of
yeah,
stopping that healing cascade.
What about like soft tissue work, or like, is there anything of where you can be destructive of like,
I think that pain is your guide in terms of that, and it's just you gotta be gentle with your body, and you gotta let it heal. I generally like, for fascia blasting and stuff, I'd say, like, "Hey, let's wait a week or 2." Can you start, like, gingerly sort of working the tissue, heating it? I think heat is amazing because again, it's kicking off that cascade and giving your body, like, the right temperature and for those enzymes and everything to work at an optimal level, like thinking about a fever. Your body works at a higher level there. So heat is great for that, and then if you're doing that soft tissue work, to be really ginger and make sure the tissue's really good and warm.
okay. And
Yep.
then lastly, just, I'm just thinking of questions that
Yeah.
patients
yeah,
typically have is talking about like the day or so afterwards, how should you feel? Because with, when you're increasing the inflammation rate, in an area to get it to heal, it should ache.
Yes, and so initially, because of the anesthetic, you're like, "Man, this feels great, like, this is the best I've felt." And then the next 24, 48 hours are pretty achy, kinda like if you think about when you have a fever and your whole body just aches. I would expect the joint or that area to just be sort of full or achy feeling, and I know for you, especially in, like, the smaller tissue area where you're putting a fair amount of fluid in there, it felt really full and like
yeah,
pressure. So those would be the pressure sensation or achy feeling and maybe a touch warm, but not hot.
yeah, I love it.
Yeah.
It's so I mean, I feel like, this episode was good in terms of, we got a little bit into the weeds with some stuff, but for the most part, just touched upon actionable items that people can think about and chew on in terms of how to manage their own health and things to consider. But yeah, so I encourage everybody that's listening or watching to send some feedback and send some follow up questions, and
Yep.
we'll have Aaliyah and Matt on in the future, pretty consistently to kind of go over some topics. So if you want something specifically covered, feel free to reach out, and we'll make sure to kind of have that happen. But again, thanks guys for joining the show today, and
Absolutely.
Thank you.
um,
Thanks for having me.
yeah, yet again another good one. All the best. Thank you, everybody.
Yep.